The latest on COVID vaccines, CVS announcing it will limit access to the shot in 16 states, requiring prescriptions in 13 states, including New York, Florida, and Colorado, and simply not offering it in 3 others. Walgreens says it will give vaccines in states where we are able to do so. Joining us now to talk about all of this is neurologist Dr. Leah Croll. Dr. Croll, thank you for joining us. It is good to see you. So from your perspective, who should get the COVID shot?
Gio, this should be a simple answer, and unfortunately, public health guidance has been confusing, to say the least. So let's start with what the science tells us, which is that COVID is still spreading. Yes, some people are higher risk. I'm talking about people over 65, immunocompromised, pregnant, certain medical conditions, but anyone can become seriously ill from COVID. And that's why previously it's been recommended that everyone 6 months and older get vaccinated to prevent that serious disease. Now, as of a few days ago, the FDA has changed their tune. They're now saying the vaccine will only be labeled for people who are over 65 or who have certain high-risk conditions. And this is confusing because it conflicts with a lot of the medical guidance that comes from organizations like the American Academy of Pediatrics. So where does this leave us all? Well, the bottom line is that COVID is still here and the vaccine still works. So if you are over 65 and you do fall into that high-risk group, certainly go ahead and get the shot. If you're under 65 and healthy, it's a little more complicated. You may need to speak to your doctor about the best path forward for you, but really try and remember the science here has not changed. The vaccine prevents serious complications from COVID, period.
And you talked about the confusion we just saw here. CVS and Walgreens, they have different policies right now. So what does that mean for people?
This is an evolving landscape, okay? As you said, 3 states not offering the vaccines at all, 13 states plus DC, where regardless of whether you meet the FDA requirements, you still need a prescription for a vaccine. Some people under 65 and healthy will need a doctor's prescription for an off-label vaccine. So it's a mess. There's another wrinkle to add in here, which is that insurance coverage is still up in the air. Okay, we're not going to know more about that until the CDC's vaccine advisory panel meets. That's not slated to happen until later in September. So it's a lot of information that we're expecting to come in. We're going to have to do our best to stay on top of it and really manage these barriers to vaccines access as best we can.
All right, Dr. Leah Croll, as always, thank you so much for joining us.
Thank you.
Appreciate it.